Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I want to speak a little bit before I begin today about the opioid report that the government released yesterday. COVID-19 is one of the most significant public health challenges that we have faced in several generations. At times, it has forced us to make difficult choices and implement aggressive restrictions to limit the spread, prevent our health system from being overwhelmed, and protect those most at risk. The impact of COVID-19 and the impact of the restrictions that we have implemented are far-reaching. It will take many years for us to understand the full impact that this pandemic has had and is still having on our mental, physical, and emotional health. The report released yesterday showed the challenges that many Albertans who use opioids and other substances have faced, and the dire impact that this pandemic has had on their lives. During the first 6 months of 2020, 449 people died from apparent unintentional opioid poisoning. This is an average of 2.5 people per day. Tragically, 301 of these deaths occurred between April and June. That is a staggering number. My heart goes out to everyone who has lost someone they loved. It can't be ignored that deaths rose during the first few months of the pandemic, which we know caused challenges for many Albertans. This includes challenges in accessing the supports and services they depend on, and increases in isolation, stress, and anxiety. The impact goes beyond simply the number of lives that were lost. There were also more than 3,000 emergency and urgent care visits related to opioids and other drug use between April and June. These numbers are difficult and troubling to hear. We know that other jurisdictions are seeing similar trends as the far-reaching impacts of COVID-19 are felt across our society. Over the past several months, we have adjusted COVID prevention policies to try and make sure that individuals who use drugs can continue to access critical services across the spectrum from harm reduction to treatment and recovery. But I know there is more to do. The pandemic is still going to be with us for many months. I will continue to work to minimize the impact of COVID-19 prevention measures on access to services. If any changes are needed, we will make them. I also want to let anyone experiencing addiction, either personally or in a loved one, know that you are not alone and help is available. If you use drugs, please don't use alone. If you want help but don't know where to turn, there is a 24-hour phone number you can call to access support at 1-866-332-2322, or go to Alberta Health Services website, Help in Tough Times. I also want to urge all of us to check up on our friends and family. This is a time when we need to connect with each other and support each other. We need to look out for each other now more than ever. The rise in deaths from opioid poisoning is a reminder that the ripple effects of COVID-19 are large, and that we need to continue seeking a balance in our response. We must embrace two needs at once: the need to minimize the impact of COVID-19 and the need to minimize the impact that these restrictions have on the rest of our health. Our collective efforts to prevent a sharp rise in cases remain in place, with 158 new cases of COVID-19 identified yesterday out of more than 12,700 tests completed by the provincial lab. This gives us a provincial positivity rate of 1.02%. Currently, Alberta has 1,462 active cases. 58 people are currently in hospital, including 14 in intensive care. Turning to schools, as of today, AHS has confirmed that 13 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 97 schools with 163 active cases in total. This represents about 4% of schools in the province. There are 32 school outbreaks, 7 of which have had likely transmission within the school in at least one case, and 4 of which have 5 or more cases and are therefore listed in the watch category on our website. I remind everyone that although 2 confirmed cases in a school may qualify as an outbreak, it is not a sign that a school is unsafe. In fact, we have looked at our data on school-aged cases over the past several months and have seen that the weekly number of cases in those aged 5 to 19 has been most impacted by community transmission trends. Our highest weekly number of cases in this age group to date was in April, at the time of our peak overall, when we had 216 cases in this age group in 1 week out of 2,257 people tested. School-aged cases have fluctuated with community transmission, but since school started on September 1st, we have actually seen a week-over-week decrease from 205 to 183 to 122 cases per week in school-aged children. This is despite a significant increase in testing, with over 11,000, 18,000, and 14,000 children tested in these 3 weeks respectively. I want to highlight these numbers not to minimize the importance of school safety, but rather to stress once again the importance of limiting community transmission to make school re-entry successful. Sadly, I must report that there has been 1 additional death from COVID-19. This was in a patient at Foothills Medical Centre, and this was first reported yesterday by AHS. My condolences go out to this person's family members and friends, and to all those grieving a loved one from any cause. The outbreak at Foothills Medical Centre is concerning, and AHS is working very hard to protect staff and patients and limit any spread. There are now 29 cases linked to this outbreak, including 17 patients. Sadly, there have been 3 deaths as well. AHS continues to conduct testing and isolating of anyone who has been exposed and has significant precautions in place to prevent further spread. Multiple staff swabbing sites have been set up to increase testing capacity for staff on outbreak units, and staff on the affected units are being screened twice daily for symptoms. As I said on Monday, I know that any outbreak in acute care settings is concerning, and it is natural for Albertans to wonder if our hospitals are at risk. Multiple teams are working daily to determine where the infection may have started, how it was transmitted, and who needs to be contacted and tested to limit the exposure. AHS has strong processes in place to protect those at hospitals and other care facilities. These were essential in limiting cases in the spring and will be equally vital to the coming months. However, I also want to stress that policies and processes are only part of the equation. We all need to do our part to keep our communities safe. This fall and winter, it is imperative that anyone who is sick not visit or enter a care facility, and that we all follow all the public health measures to the letter while inside a care facility. As I've mentioned before, whether it's going to school, going to work, or visiting a loved one, staying home while sick, or even experiencing mild symptoms is incredibly important. I recognize that this is inconvenient and financially difficult for many. I continue to advocate that employers support their employees whenever possible to help them stay home when sick. I want to express my gratitude to all those who have been doing so, as I also recognize this is a difficult time for many employers. I want to end today on a lighter note. The vernal equinox was on Tuesday. We are officially into fall. In a couple of weeks, many families and communities will be celebrating Thanksgiving. This year, I think we are all very much more aware than usual about how much we have to be thankful for. First, the care and support of our loved ones as we navigate through and adapt to this new normal. Also, the healthcare workers and community pharmacies who have tested about 1 in 4 of us, and the health professionals who provide for us and our loved ones with any kind of health issues. The teachers and school staff who are helping to keep our children from harm by limiting the spread. The generosity of people and organizations who help care for the homeless and vulnerable. And the researchers who are tirelessly working to develop an effective and safe vaccine. Pre-COVID, we may have taken some of these things for granted. No more. And so it is natural for people to want to come together and celebrate Thanksgiving with a new level of appreciation. At the same time, we all want Thanksgiving to be a safe holiday that keeps everyone healthy. Guidance to help Albertans have a safe Thanksgiving has now been posted on alberta.ca, and I'll tweet out a link this afternoon. To summarize, it's best to keep gatherings within your established cohorts of up to 15 people outside your household. Smaller is safer. This is not the time for large gatherings. When shopping for your Thanksgiving dinners, maintain physical distancing, wash or sanitize your hands often, and observe local mask requirements. Food plays a big part in many holiday get-togethers. Please have one person plate everyone's meal so people are not sharing serving utensils. Or even better, consider having pre-portioned servings, ordering takeout, or perhaps having guests bring their own food. If you are visiting loved ones in care, do so by appointment only and follow all facility protocols. A few common sense precautions will help keep everyone safe. It's also important to remember that getting outside is a mentally and physically healthy thing to do, and as Canadians, we don't have to let the changing weather stop us. We can embrace the outdoor weather, dress appropriately, and find a wealth of things to do through the fall and winter. Just maintain physical distancing outside your cohort, wear a mask when you can't, observe good hygiene practices, and stay home if you're feeling sick. I want to particularly emphasize that last point. If you are feeling any symptoms at all, it is important that you stay home and away from others. This goes for Thanksgiving, Halloween, and every other day as well. We are all protecting each other. The spread of the virus and the safety of the holidays we cherish is on each one of us. We are all in this together. Thank you, and I'm happy to take any questions you may have.
All right, we'll go to the phone now. There is a large number in the queue, so if media could keep it to one question only, we will try to get through as many as possible. Operator, could you put through the first caller, please?
Yes, first is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. In the Prime Minister's address to the nation yesterday, he said COVID-19, the second wave has already begun. I was just wondering if you share that same thought and if this is the time that Alberta should reintroduce some stricter measures.
The concept of a second wave implies that we don't have any control or influence over the circulation of the virus. And I think that certainly there are some provinces who have themselves determined that they are beginning what they're calling a second wave. But in Alberta, I don't think that that's where we're at right now. We have seen increased daily case counts for the last few months, but those have remained relatively stable. And when I think about a second wave, I think about a very large spike of uncontrolled spread. And that's not our only possible future. Our other possible futures are a stable, relatively slow burn of a constant case count over time, or perhaps small ripples that go up and down. And that's entirely within our power and our control as Albertans about how that spread happens in our communities. And so we continue to monitor our information, our epidemiology about where our spread is happening. And to date, we have not seen any single factor that seems to be driving the majority of cases. And therefore, we have not imposed any additional restrictions. Again, whether or not we have a steep, sharp second wave is entirely within our hands, and we can prevent that without any additional formal restrictions.
Operator, could you put through the next caller, please?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, Dr. Hinshaw. I'm wondering how we expect to see our statistics change in the light of the decision last week to remove asymptomatic testing for most Albertans. Are we going to be seeing higher testing positivity rates, for example?
You know, it's interesting, that particular change has not actually impacted our volumes of people who are requesting testing. And so we're still waiting to see how that impacts our overall volumes. But so far it has not increased our testing positivity rates and has not, in fact, even decreased our overall testing volumes. So I think it's a little too early to say, as it's only been a short time since we made that change. But so far we're not seeing a massive shift in either volumes or positivity rates.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Albertans were given models for when the pandemic first started and then a revised version of it. How come an updated provincial model, particularly for the fall, has not been released?
You know, I was reading something about models the other day. Someone was using the analogy of models as a flashlight, that they can show you what might happen going forward, but they don't predict the future. And that's true of our models in the spring, that they showed us what could happen, and we made choices to take a different path so that we didn't have that particular steep wave. The information we have about the virus now, in terms of how it spreads, the basic reproduction number from one person to the next, is in some ways relatively similar, that basic information, to what we knew in the spring. So any model, what it essentially would show us is that if we collectively backed away from following public health measures, that we would see an increased spread, and if we collectively continue to follow the public health measures, that we can keep that spread relatively constant. And so while we are looking at different modeling to help us answer very specific questions, that overall question of what might we see in the fall, I don't think we need a model to tell us that. I think we already know. If we don't follow public health measures, we could see that so-called second wave. If we do, we'll see relatively stable and constant cases over time. And again, it's all in our hands.
Operator, could you put through the next caller, please?
Next is Sean Furnett with GTV. Go ahead, Sean.
Hello, Dr. Hinshaw. Officials across the U.S. and Canada are becoming targets with personal threats leveled against them, hate mail sent to their offices and homes, and many now have police protections. Dr. Bonnie Henry was also commenting about how she's been affected the other day. Why do you think public health experts are being targeted, and have you faced any threats or harassment during this pandemic?
The pandemic has caused a lot of suffering for a lot of people, and when public health professionals are often at the front of speaking about the pandemic, I think we collectively can become a symbol for that suffering that people have experienced. In my case, although, of course, I receive a lot of correspondence from Albertans and have certainly received some very sharp personal and professional criticism from some of them, I have not received what I would categorize as hate mail or threats. And instead, I would say, again, while there have been some people who have been very upset, there have been others who've sent notes with very thoughtful and respectful questions or suggestions, and others who've sent notes of appreciation for the work that our team is doing. So again, I think I've heard that full spectrum, and I think it's not surprising that when people are experiencing the impacts of the pandemic, that unfortunately sometimes they take it out on the person who is the spokesperson about why we need to manage collectively through this in ways that can sometimes cause suffering.
Operator, could you put through the next question, please?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Well, Dr. Hinshaw, in 2008, as the co-chair of the Minister's Opioid Emergency Response Commission, your first recommendation was that the government fund supervised consumption sites. You were also supportive of safer supply. I'm wondering if you're still pressing for that, particularly supervised consumption sites, and how that's been received.
So I think that it's important to separate out the work of the Minister's Opioid Emergency Response Commission and the recommendations that were made at that particular time in that particular place that were appropriate to that context and our particular context today. I think that it's critical to have a broad spectrum of services available for individuals who use drugs, from prevention to harm reduction to treatment and recovery. And the decisions that are made about the allocation of resources along that continuum are policy decisions, and the specific debates and deliberations about that and the questions about decisions made about resource allocation along that spectrum are best referred to the Associate Minister's Office of Mental Health and Addictions with respect to, again, those difficult decisions about where resources get allocated along that spectrum. And again, what I would say is that it's critical to have that broad spectrum of supports available.
Operator, could you put through the next caller, please?
Next is Andrea Hunkar with CBC. Go ahead, Andrea.
Thank you. Dr. Hinshaw, I just have a follow-up question continuing with the harassment Dr. Bonnie Henry is facing. How much of the abuse do you think goes hand in hand with being a woman in a position of power? Have you been targeted for being a woman in a position of leadership, and what should be done about it?
That's a difficult question to answer. Of course, I only have my own experience to go on, and I don't know. It would be difficult for me to compare that with what other people have experienced. It's not something I've discussed with my male colleagues across the country, so that might be something of interest to find out if they're experiencing some similar frustrations. But again, I think it is quite understandable that people do feel angry. It's just really important that if people are feeling angry, that they frame their concerns in a respectful way, and that, whether people in leadership are women or men, anyone in a position of leadership does need to make decisions with the full spectrum of perspectives, but it's important that be expressed in a respectful way.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next is Dustin Cook with Post Media. Go ahead, Dustin.
Hi, Dr. Hinshaw. I'm wondering, on the outbreak in the Hope Mission shelter, Edmonton's first in the homeless community, assuming the shelter is staying open, is the distancing requirement between sleeping spaces going to be expanded to at least 2 meters? And if not now, what is the threshold for that change?
Our current guidance requires a 1 meter distance with people sleeping head to foot on mats in a shelter situation when that shelter is not in an outbreak. And when there is an outbreak, then that distancing does need to be increased. I haven't connected with my colleague locally to confirm that is being done, but that's part of our guidance, is that when there has been exposure in a particular community, that there is that extra precaution taken. And in general, what we have seen in outbreaks in our population of those experiencing homelessness is that it does seem to be other mechanisms that put people at risk of the spread of COVID, and it has not to date seemed to be linked to those sleeping arrangements. And if you look at 2 mats which are 1 meter apart where people are sleeping head to toe, that is actually about 2 meters of distance between one person's head and the other. And so right now, again, we have that in our guidance as an acceptable regular standard. Of course, if evidence were to emerge that it was insufficient, we would look at that and reconsider. But right now, that is the regular standard to be expanded when a setting is in an outbreak.
Operator, could you put through the next caller, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. When you were last speaking with us, you talked about some of the reports you were hearing about how the outbreaks at Foothills Hospital may have started with inconsistent mask wearing when visitors and potentially staff members working while symptomatic. I'm wondering if you have any updates on how these outbreaks may have started.
I have no further information, and of course this is something that's of great interest to that outbreak management team, and they are looking very closely at what those factors were, but I don't have any further information about what exactly contributed to the introduction of the virus in the facility.
All right, Operator, could you put through our final question, please?
Final question is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. In preparing for a possible second wave in Alberta, are we looking at having any kind of targeted lockdowns like Ontario is looking at, maybe on specific kinds of businesses or places where COVID is spread if we go into an uncontrolled second wave? Do you have anything you can tell us about your approach if that happens?
Absolutely. Since we have been moving into our second stage of relaunch, so ever since June when we launched our map that indicates when areas are in watch, or if we have not yet to date had an area move into an enhanced category, but that enhanced category is really for areas where if we do see a particular issue in a particular geographic location, then we may need to impose certain additional measures to prevent spread in that location. And yet to date, so far, again, we have been able to keep the spread relatively constant. We have, of course, seen some areas that have gone up and down in their rates, but we haven't needed to impose additional restrictions. That framework does allow us to be more targeted if we should need to consider additional restrictions, to look at what our data is telling us about where spread is happening, both at a geographic level, but also at the level of activities. And so I think that is the way that we would, if needed, control spread if spread was happening at a rate that was concerning and starting to accelerate, is by looking specifically at what the data says about where the spread is happening, what kinds of activities, and also at that local level where we do need to put those measures in place. But again, thanks to the efforts, the collective efforts of all Albertans, we have managed over the past several months to keep our numbers relatively constant. And again, that future is all in our hands, and we can proceed without additional restrictions if we all work together.
All right, thank you for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a good day.